But you know, that's it.
That's true. We've got to do more of that. The piece of legislation I authored and it got through the House dealing with the tariff balancing has created 200 jobs at a plant in Garland. The only plant left in the United States of America, corporation, that manufactures shirts. Men's shirts and women's are made at that plant. Now that's hard to believe at a time when we had plenty of them here in this country. And I think we have to take a much stronger stand on enforcing our trade deals, because we don't do it, so that we can have one more time in this country made in America. That's part of the reason we got high employment. Here in this community, there used to be an awful lot of textile jobs. Those jobs are gone.
And they're gone.
And they're gone. And part of that was because the large multi-international corporations were incentivized literally by tax policy years ago, and we closed that loophole for letting them ship them overseas. That makes no sense at all. It's just not good policy. It's not good public policy, and it's not good policy for creating jobs for people.
Let's talk about securing our borders. We have 11 million illegal immigrants over here in the United States. Now, you were for building the fence, is that correct?
Yes.
Can you speak to that a little bit?
Well, you've got to protect your borders. I sat on Homeland Security long enough to know that a country that can't secure its borders has got real problems.
Right.
And that's a problem not just for the United States, around the world. But it's a bigger problem for us because of we have a lot of border. We're a big country.
We are.
And we need to have border protection first and enforce the laws that we have on the books. Because there are folks who want to come here and work, and we need them to work. We need them to work in the agricultural sector and a host of sectors. And we need to streamline and fix our immigration system. It is flat broken. I don't think anyone that knows anything about that would really disagree. So that people can go and come legally. We have a lot of folks who come here on visas, student visas, overstay them, and they're here without having legal status. And they're part of that number. And in this day and time, when you can take a credit card and go to a bank on the other side of the world and get money, we ought to be able to have an immigration system where we can know where people are. We put one in several years when I was on Homeland Security, dealing with what's called, if you wanted to hire someone, you could check their Social Security number. Now you can't take it was the same person, because in a lot of cases, some people were stealing Social Security numbers. We know that happens. Now eventually that gets caught up, because once they get checked, comes back, if you're in business, you know right quick, it pops up and you fix it. But we got to do a better job. There's no question about it. And currently it gets to be a bigger issue in times like these when jobs are tough.
Well, let me ask you this question on talking about illegal aliens. Looking at your voting record, you voted no on reporting illegal aliens who receive hospital treatment. And I just wanted to know why. It was, for instance, if they received hospital treatment and they could be sent back to their homeland and they were illegal, they would be sent back. But explain your reasoning for being against that.
Well, it depends on where that was in the bill. That may have been tucked away. It wasn't a straight up bill. It was tucked away in a bunch of other stuff, is usually what happens. And someone will put an amendment that's called catfish amendment, something to kill a bigger bill. And so you don't want to include a bill that would kill an appropriations bill, as an example, that's moving forward. That's normally the case, the way something like that gets popped up.
I hate
how that works.
Well, it makes no sense.
Why can't you just vote for, why can't it be just about what it needs to be about?
But because what they want to do is have something just like that, so someone will ask a question in an interview, or it shows up in an ad. And if you would do it in a straight up bill where you were really trying to fix it,
when you're trying to correct a problem,
you could get it done, but unfortunately, that's not the world we live in. I'm sorry. That's just not the world we live in.
Our time is running out. Why should we send you back to Congress?
Well, I get up every day thinking about the very issues we've talked about. In this time when we really are facing some very challenging issues in this country, you really need someone who knows what they're doing. and knows how to work within a system, but at the same time listens to the people back home. You know, I've done a little bit. I grew up on a farm. I still have access to one. I work on it.
You have a lot of farmers that contact you.
I hear from a lot. Matter of fact, when I leave here this morning, I'm going to meet with farmers at the tobacco warehouse. Who've got issues. I was state superintendent of schools. I know a little bit about education. I know what not to do. But I think the important thing is, in this environment, we really do need to create jobs. I sit on one of the committees that we haven't had a North Carolinian on for almost 60 years on Ways and Means, which gives us a chance to really get some things done for the people in this district, because it is about, at the end of the day, what do you do for the people you represent in the 2nd District. And the 2nd District is probably one of the most diverse districts in the United States of America. It runs from high tech at the Research Triangle at NC State and to Fort Bragg, which is the premier military base in the world, and next year it will be the largest military base in the world. To agriculture, to people who have tremendous needs, working in plants, and we have a high level of unemployment, but it varies from county to county. You know, people really wanting to work and needing work to do. So I know how to get the job done, and I think that's important.
Well, you know, this health care scares everybody to death, Congressman. And the general consensus was that you didn't listen to the people in your district about health care. Can you address that?
Sure. I heard from farmers who said, if this thing isn't fixed, I can't keep paying my own premium. Or a nurse up in Sanford who said to me, I'm tired of the insurance company running our clinic. You know, I'm having to, I answer the insurance company, not to our patients. Or a lady in Raleigh who wrote me who said, my sister died of asthma because she couldn't get insurance. You know, that's unfair in America, and she's right. And yet you hear from hospital administrators who say, we're taking people in the emergency room. Most expensive place we treat them. Here in Wilson, Rocky Mount, Raleigh. Administrator Raleigh said previous year before it passed, their uncompensated care or unpaid for care in the emergency room and other places was $120 million. Now, guess who's paying that? We are.
Right.
Everybody who goes to that door and pays is paying for the people who aren't paying. So shouldn't we try to put a system together where everybody pays something, where they have to have an insurance plan to go? And the bill also said if you aren't a citizen of the United States, you can't get a certain credit depending on your income, so you can have an insurance plan. But think of the empowerment it gives an individual to say, hey, I got an insurance policy, I want to see a doctor. Then you set up enough clinics around the country, which is starting to happen, where people go there instead of showing up at the emergency room. Because you show up at the emergency room where it would normally cost you, let's say, $100 or $200, you're looking at several $1,000s, and we're all going to pick up the tab.
Well, you'd agree there are flaws in that bill.
Oh, no question. We've never passed legislation that didn't have some,
and isn't that a shame?
And it's going to be revisited. You know, and if you go back to Social Security, which I think was one of the more important domestic bills we've ever had, it's been revisited a number of times, fixing it. Medicare. Gosh, that's why legislators meet every year to work on just a simple thing of driving down the road and an ability to deal with speeders or people who do things on the highway. You know, you change the law from year to year to adjust, because when Highway Patrol first started patrolling the roads, we didn't have cars as fast as they are today, or things were happening. The same is true in medicine. I remember as a child, when my parents would carry me, they'd only carry me when I was sick. I didn't go to get a physical. Today, with children, if you have little children, what do? They go to see your pediatrician. You get prenatal care, which I think is great, because if we get prenatal care, we're going to have healthier children. This bill also says to seniors, we're going to close the donut hole for you, but you know that's a real problem. You can start in January 1, you can get your checkup without having copays. For a lot of seniors, they won't go till they get sick, and then they wind up in the hospital. No lifetime caps, no denial of being in because of pre-existing condition. I had a farmer tell me the other day, he said, I just hope I make it to 65. I have diabetes. My insurance was costing me, and still is, over $2,000 a month. He said, you know, I can pay it. He said, but a lot of folks can't afford it and don't have it. So guess where they wind up? At the emergency room when they get sick. So there are a lot of things that you try to work through. It isn't perfect. But insurance,
a lot of people didn't realize, I don't mean to interrupt you, but if you're receiving health care from your employer, that goes as part of your income now,
Sure.
and you've got to put it on your taxes. And a lot of people didn't
know they were doing that.
Didn't know that. I heard somebody say, no, you're wrong. That's not right. That is right. And people didn't know that. But there's got to be what people don't understand is there's got to be a way to pay for this program.
Yep.
You've got to have a way to pay for any program that you create.
And in this passage, people are encouraged to stay with their employers because the employer still gets to deduct it off their income tax. So from that standpoint, it's an incentive for employers to continue to pay it and deduct it as a part of their cost of doing business. So there is a big incentive.
But I had an employer tell me I'd rather take the $750 hit of the fine per person because it's cheaper than me having to pay for health care for them for the year. So I'm going to let them figure out what insurance, and that's going to happen.
And some may do that, but at the same time, you know, a lot of employers want to keep that person with them.
Right.
And if they are good employees, they're going to make it, well, you know, I can provide it. I can provide this little extra for you. We can take it off. And that person stays loyal to the company. I know. I was in business. We were in manufacturing for 19 years, and you don't want good people to leave if you can help it.
Okay, we got to go.
It's a pleasure.
Well, thank you so much.
Thank you for letting me be with you.
Congressman, thank you so much. You want to ask for everybody's vote?
I do. I'd encourage you to go vote. You can vote early until Saturday at noon. Please go vote, and I would be honored to continue to represent you in the 2nd Congressional District, solicit and ask for your vote. Thank you.
And we'll see you tomorrow morning on the Don Bullitt Chevrolet Cadillac Morning Show. Lisa and myself.